will see how many people will retain in the room once I'm done with my presentation. So I call it from metagenome to policy and practice, how to bridge the gap for AMR. And I know most of you are lab and clinical researchers, but policy and practice is also important to make impact and bring change. So in my presentation, I will cover, give you the political environment of AMR response globally, and then I would analyze and share what metagenomics could do, i.e. surveillance, to contribute for the global response. And then I will also share how we actually narrow the gap between basic science, basic research, and policy from my past experience in TB and HIV. And then I will conclude by showing some way forward for opportunities for this gap. I'm not going to say it, and Stefan, I quoted this one, so I think he said it, I will pass. And the complexity of antimicrobial resistance and the drivers, as you can see, it's everywhere. Basically, it involves animals and humans. We share antibiotics between beings. Beings include also plants, because the plants are also sprayed with antimicrobials, antibiotics in our world. And this actually also brings the complexity, beyond the animal, beyond the human, into the environment, because everything that goes in will go out. And that's also another challenge, and the food and the feed. And I have seen in farms where actually antibiotics are put with a spade into animal feed. So that's also a major challenge, really, to show you how complex the challenge is. And the complex challenge then requires comprehensive response. So that comprehensive response cannot come only with one sector. For example, only the human sector, which you are actually discussing, for patients in hospitals or in OPDs, only talking about them, we can't actually bring a comprehensive response. That will be like clapping in one hand. So that's why we have to work with the animals, with the plants, and with the water and sanitation, with the environment, and try to address and rationalize our response in a much more comprehensive way. So that is why we have the organizations working around AMR addressing this complexity in their specific areas with specific actions. So we had the Food and Agriculture Organization. It's a UN organization, and it deals with agri-food system, the food production, the agriculture, the animals. And then we have also the UN Environment Program, which deals with, it's a UN organization, it deals with the environment. And we have the WHO, of course, dealing with the human health side, but we have the World Organization of Animal Health to deal with animal health. So that's how we are working together, these organizations, to address the complexity of AMR through a joint secretariat, which is based in WHO, that addresses major issues across these different sectors, and trying to find a common ground. 5-6 years ago, these organizations, they were not agreeing in anything. And there were, for example, the use of antibiotics for growth promotion, just feeding animals to get fattened, was a very divisive agenda. That these organizations, they have their own perspectives, they have their own angle to see it, because it is about food security. It is about feeding family. It's about trade. It's about meat export. So for some policymakers, where they don't actually see the impact of drug-resistant infections, those 12 patients that you see dying in Geneva every year, will that matter for a country of making millions and billions of dollars feeding into the economy through, trade. So I think these are the challenges that the so-called insidious pandemic will not show that tragic impact and effect on politicians like what we see in COVID, for example. We are not seeing that, and we will not see that, I think, because it will still continue to be a slow, process to bring that days, because patients will die in any way with complications. They're not going to die what we have seen in viral pandemic. So I think that is why we have to really look into these organizations, so that what we did was to develop a strategic framework rather than fighting what can make it to, us to work together. So we have identified the vision, we have identified the goal and the impact, what we were trying to achieve. So the bottom line is we need to preserve our antimicrobials, our antibiotics. That is a starting point. So those working on animal health, in plant, in human, all our effort is to preserve antibiotics. And of course, how do we preserve antibiotics? In the human health side, it's the stewardship. It's making with a proper diagnosis and the proper, so that the antibiotics continue work. So we have also that shared vision with those working in animals. And animals, they divide them into companion animals like cats and dogs and horses, and then we have the food-producing animals. For some, not some actually, for most, the companion animals like a family member. And the food-producing animals are, of course, therefore more for trade. But how can you actually also reconcile, even in prescribing or making access to antibiotics for companion animals, versus human beings? So because they are all sometimes are taken the same, and for veterinarians, they are patients equally. So I think these are the type of discussions which we have really to bring that shared vision and shared goal. And this strategic framework helps us. And as part of this, of course, surveillance is critically important. Surveillance is based on the metagenome, how to measure, how to, in the environment, in the West, wherever, how can we actually make sense out of that data to influence the perspective and behavior and practice of the clinicians, the veterinarians, and the policymakers, the environmentalists. So it's critical. So I think this strategic framework also gives that emphasis that we need to have data that can help us to achieve what we want to achieve, preserve our antimicrobials. So just to show you, we have already established systems and mechanisms how we can use the genome sequencing. And WHO has actually a guideline how to use whole genome sequencing for surveillance. And there are also different collaborating centers that are working to bring some coordination on that. And the same is true for FAO with agri-food system. They have a lot of genome sequencing to work in animals with collaborating centers. Also in WAHA for animal health. So the whole issue is that there are these efforts, but these efforts are not bringing that data to help that change in policy and change in practice and in behavior. And also environment, it's a very poorly defined, but the importance of genome sequencing really to understand and to highlight, to generate the evidence, because we are saying now we all excrete antimicrobials, they go into the environment, but there is no established link whether that is really causing any significant public health challenge or resistance. We don't. So I think having those data generated will be critical, and I think genomics, metagenomics will play a great role in that. And of course, there are attempts of integrating to show, and this is what they call global, tricycle surveillance, where they were trying to bring, E. coli by taking it from humans and also from animals, just to really to understand how policy can be informed, and it's been implemented in countries, but it has also its own challenges. But just to show you that actually there are some efforts going on, but still not bringing us the maximum impact we want. And of course, I'm not going to tell you this. There are so many metagenomics studies generated useful data, and but we don't see that actually impacting policy and program at scale. So what can we do? What are the opportunities? First, surveillance is a political agenda. And this is a global leaders group that actually deal with political action on AMR, led by the Prime Minister Motley, the Prime Minister of Barbados. I hope some of you may recognize her. And we have also ministers as part of that, and surveillance. And this group is advocating, for availability of political action, availability of resources. And as part of that, there is actually in their action plan to promote global genomic surveillance of AMR with integration of priority pathogens to create global network is part of their deliverable. So they are working, and it's been also developed. Similarly, next year, we will have the UN high-level meeting where heads of government from all over the world, hopefully, will come and discuss about what actions can be taken for the next few years. And surveillance, it was addressed in the last high-level meeting in 2016, but in a very minimal way, with no specific language and with no actionable language that we are now also trying to do. So there is an opportunity. Malta and Barbados have been identified. This is a political process that will be negotiated for months by these two ambassadors based in New York. So this also gives an opportunity, if the metagenomics community come with some smart solutions and ideas, there is an opportunity actually to integrate it here. Similarly, the quadripartite, the 4 organizations I mentioned earlier, we have actually established a technical group that will further hash out what needs to be done. And they are going to develop before the end of the year, actually, a guide on integrated surveillance, which will include, number one, the definition of integrated surveillance. What is integrated surveillance? And then what are the indicators actually to show for that integrated sort of surveillance, which pathogens and how to measure. But most importantly, it will also give guidance how to use genome sequencing for addressing this, because there is consensus that genome sequencing could be a disruptor for what's happening now. So how to do that will be given by this group. And also now, as I said, there is a gap between the data that is being generated from the lab into policy. What are the lessons from other programs and the TB-HIV lesson? So what we did in the TB-HIV was, CROI is a very respected HIV conference, which actually you have to submit your CV to even, to be allowed to get in. I think now it's becoming more and more open. It used to be very exclusive. And in that meeting, it's really pure science discussion. So what we did was we start after discussing with co-organizers to organize 90 minutes, just before the opening day, just before the opening with lunch, and just bring researchers, basic science researchers and policymakers. And few, maximum would have been 30, 40 people in the original stages. But what we used to do was we bring, controversial issues. We bring 2 groups with different views to come and actually discuss what are those issues. And then discussing those issues will, bring that intellectual discussion that spark for innovative ideas and research questions. And I'm happy to say, actually, a lot of researchers with contrasting, views were able to actually collaborate, following, these meetings. And what we did also, we report just 1.5 page report of the meeting within 24 hours, maximum within 48 hours, and then we share it. So that actually also brings that momentum and interest of the scientists, to be part of this type of discussion. So just to give you an example, what has happened over 10 years, just to show in 2017, where actually the global TB control was mostly done for smear positive, using smear microscopy, focusing on only smear positive. But we know that HIV positive people, they don't excrete sputum, and you can't see their TB in the smear. So a lot of HIV people were dying. So then the whole issue is is the WHO, mechanism is working? And this is a very sensitive time also, because the whole world was going to 70, detecting 70% of smear positives and treating 85. It's a huge target and political momentum. So this was a very, disruptive, but it's a discussion on that, saying the current policy, the current smear positive focused approach is not working. And then having that scientists and clinical researchers and policymakers to debate has actually helped for the policymakers to analyze the practice, and then that has actually yielded for the development of WHO policy with algorithm based on those discussions. Because that time we didn't even have the evidence, but we said, okay, let's develop the policy, the algorithm to address these gaps which we identified, but let's also evaluate it. So it was done and it was evaluated, and eventually it has been incorporated into a global policy at scale, implemented in many countries. The other one was how to actually put, again, HIV positive people on TB treatment, TB preventive treatment. Because TB preventive treatment, you have to give them, and once you are sure that they don't have TB, there is no infection. Otherwise, you are under treating them, and which actually has a lot of consequences. So for that, actually what has happened was it was again discussed in those meetings, and it was debated. And one of the ideas that was generated by those scientists in that group was, okay, we have data set which we published. Why don't we contribute the data to WHO, and you do primary data analysis pooled, and then we see how whether we can develop science-based screening algorithm. And this is exactly actually what we managed to get 30,000 patient points, out of which 11,000 were able to be really looked at because they were symptoms reported to those patients. And we developed this. This was published on PLOS Medicine, and with the CDC and WHO, and with all the researchers up there who contributed their primary data. And this never happened before, because data sharing among researchers is always a very sensitive issue. But they were willing, because those meetings and those discussions really helped that everyone wants to contribute. And guess what? This again led to the development of a WHO policy, and then within 3 years, look, the role of IPT uptake. And today, actually, it's millions and millions. I just stopped just to show you the immediate effect of such discussions and policy. And there are others. One was, there was a concern that TB patients were not included in clinical trials of new antiviral drugs, antiretroviral drugs. And that actually also, started with writing a commentary perspective in a scientific journal and bringing, the different scientists. And then it has really helped actually today. All new antiretroviral drugs are tested in TB, and then they are immediately being eligible. And that has actually also really resulted in the quality of care. So what is overall impact? I mean, there are others creative ideas like a combined pill of cotrimoxazole with INH. It was an idea generated in those meetings, and then we followed it through with essential drug. We asked for interest for manufacturers. Today, it's a policy. There has been trials that done, and now it is in the WHO essential medical list. So it's a lot of creative ideas can come by bringing policymakers and researchers together. And you can see that millions of lives were saved because of those policies which I mentioned. So what is the way forward? I think, you know, if you look this, I'm sure you may be aware of it. It's published in 2022. The framework is there. This is a really nice conceptual framework to guide the work, how metagenomics can actually influence policy and practice. And you can see also how they, you know, show the span of reach of this bench research into economy, national, international, climate change, global trade. But the most important thing which I like from this is they have also included public health, because public health is critical, and also make sure that you work across sectors. They call it one sector. So the framework is there, how to actually use this metagenomics and basic bench science for policy. And in doing so, what needs to be done is probably also to engage, as I said, with policymakers and discuss the key issues. You know, cost is an issue, as you all know, you know, the technology, and also the financial need. You know, if you want to do clinical trials, you need resources. So how can to get those resources and data privacy protection? And then also, how can we use these genomic mechanisms for routine surveillance? The routine surveillance should impact patient care at the end of the day. It should prevent, if possible, or should inform the prevention of the development of antimicrobial resistance. So how can, you know, the basic science, the genomics can help the policymakers to bridge that gap. And then, of course, we have to also look the north-south bridge, how to also build capacity, and access is also a big issue. So these are just like, you know, could generate interesting research questions, you know, to be debated and to be followed up. And of course, at the end of the day, applying basic principles of public health is critical. You know, public health, a very sophisticated machine to really impact health at a broader level. You know, I'm a medical doctor, but a public health specialist, so I'm maybe biased. But at the end of the day, looking the population health will also, of course, benefit the patient, but may not be the whole 100 patients if you want to treat it, maybe 95. But the impact of a public health approach, you know, based on these key steps, you know, identify your problem, target the risk factors, and also the interventions, you evaluate them and you scale up. But the most important element of a public health approach for me is it should be based on evidence. The data has to be there, and surveillance, of course, is critical, but most importantly, standardization, simplicity, and clarity. We have to be simple, we have to be very clear, and once it has to be consistent. It has to be standardized. So that will actually really help and expedite that gap of policy with basic research. So in conclusion, I believe metagenomics is critical for revolutionizing the global AMR response. Of course, we need standardization, we need simplification, we need that engagement. And data generated has to always target to influence policy and practice, and ultimately patient care and continuous improvement. And as I will repeat again, public health gaps needs to be addressed by bringing researchers and policymakers. And then don't miss opportunities like the upcoming political opportunities and this high level of global interest. Thank you very much.
We have time for some questions.
Well, thank you first. It's very interesting. Maybe a global question also after this whole day of presentation about the AMR. I have the impression we are looking at the tip of the iceberg when we only focus on the AMR. There is this global burden of infectious disease and infection, and like other aspects like hygiene, access to clean water, sanitation, so on, is also critical. And you mentioned that. I was wondering, what is WHO doing to improve access to clean water, or recommendations, policies, and so on?
Yeah, I mean, clearly, I mean, it's a driver, as I showed on this slide, but it also adds into the complexity of how we are going to address AMR. Because, of course, in all these are touched, the water and sanitation, the infection prevention, not only in hospitals and clinics, but also in veterinary, even in the barn where animals are staying. If we have good infection prevention there is less need for the antibiotics. So it's a broad issue, and it's not only WHO, but also the other organizations. They call it biosecurity in the animal health. There is work going on, but in a situation where you have, I don't know the statistics, even for health facilities. Not all health facilities are, sustainable running water, for example, So there are some fundamental structural challenges, but should we just fold our arms and sit? That's not, the option. So I think that's why we have to have that comprehensive, when I say comprehensive response, we have to also address all those challenges at the same time, but also be cognizant what are the low-hanging fruits where we can, address.
Yeah, I would have one question. Thank you for it's very interesting. So you mentioned the tricycle program. It's really happy you did so because it was my former boss, Antoine Andremont, who was instrumental in setting up this program, and I've been involved in following some of the tricycle implementation. And this is supposed to be a very, very simple, protocol, even though it's not that easy to set it up on the ground, but it's still feasible. But then the sustainability, which is one of the key points of this program, to be run every year in the same place, is even more challenging because of the lack of sustained funding. And I'm just wondering how the WHO could not constrain what could urge the governments maybe to take over and just found, some yearly campaigns of tricycle. I mean, it's not that much, it doesn't cost that much, but many campaigns have just been run once and then it just vanished.
No, I think that's a very good point, and that's why I was also a bit guarded on my comments about it. The main challenge what we faced today, and as I said, I came from TB HIV, public health, where you have the global fund with billions and billions of resources supporting countries. We don't have that for AMR. So I think that is the main actually ask. Financing is the main ask for revolutionizing, the AMR response. And this has been a hot discussion now with the ANGA high-level meeting. The three issues that are, accountability, because if you go into countries, also it is not like dealing with infection, disease like HIV or TB, just one disease. You can have one program and one Ministry of Health, and you just go there and you act. But here you have animals, you have environment, you have, it's a complex. But there is no also that central governance at country level to actually with authority and just to say, oh, this is how we should do these things. So I think these are the type of issues that we are trying to also address in this upcoming, political declaration. If the heads of government are saying, yeah, we need this and we want to commit this, and projects like Tricycle will benefit. And But again, when those type of projects are also, crafted, it was just protocol, that was done without also understanding as you say, the complexity and the difficulty. But I think we should also learn how to make it a rolling, type of, policy and protocol, because now actually WHO is compensating for the glass system with prevalence surveys, which we want to really be representative, having nationwide data. And we have the protocol already, but I think we have to also be on a continuous learning curve to learn and to adjust and adapt. So I think that could also be one advantage to support tricycle.
I had a curiosity about the example that you made about the CROI and how that helped reshaping politics around the management of patients with TB and HIV. How do we put together in the same room people that work on AMR if the landscape is so much more complex? Because you have the Dynagans, people that work in the meat industry, for instance, and of course, clinicians. So it seems to me that it's very challenging to even try to achieve something like that.
No, I think, I'm not suggesting, if I said metagenomics, okay, or it's only on the surveillance. We are actually, addressing it with ECMID, for example. And the last 2 years, we have been working with them. And I don't know, most of you are attending that, but last year, for example, we had like a 3-hour pre-opening AMR session, with ECMID. And we will do it also next year in Barcelona. And there we are addressing, the broader issues of bringing researchers of this wide, because one idea we have is also to change ECMID. It's international, although they call it European. I think 60% participants, 40% are coming from outside of Europe. So we are also trying to boost that, because that is the only conference that we thought would bring, veterinarians, microbiologists, infectious disease experts, and policymakers. So we are addressing that broader issue within that platform. But I think for you around surveillance and how to really, boost this metagenomics to influence and policy, I'm sure you have your own similar conferences where you have your core metagenomics, but then the policy you have to liaise, with either of the 4 organizations, depending on the agenda, how to bring them. And we are always happy to collaborate with that.
Any more questions? Well, if not, thank you again so much.
Thank you. Thank you very much.
Before I leave the last words to Jacques, I want to thank you all again for attending these LabLinks meetings. I hope you enjoyed it. I think we had a day of exciting science where we had the chance to think about this global problem from a variety of perspectives that overall highlight the need to tackle the challenge of MIR from a very broad variety of approaches, from well-designed populational studies to innovative therapies like monoclonal antibodies or vaccines, to all therapies that are becoming new again, like phages, and new models of infection, as well as public health approaches, which, as we've seen, is important to put all of this together in the context of a much broader issue. Before I conclude, I'd like to thank Colette, Nadia, Shiraz, and Yves for helping making the conference run smoothly. I really appreciate your help. And I would like to thank all of you again for being here today, and all our speakers, the ones in person, the ones remote and close and far away, for being here and collaborating to this day. And now I'd like to, it's my pleasure to leave the floor to Dr. Schrenzer for some concluding remarks. Thank you.
Thanks, Salvatore. No worries. We won't go beyond 6 p.m., so it will be short. I'd like to thank Salvatore and Shiva for organizing this meeting together with us. I would like to thank the speakers and bring a few views that will stay in my brain, and maybe you will have the same. I'd like to go back to that journey during one day where we went very deep into the SNPs, trying to see what was the difference leading to increased transmission, to genes that could lead to very different outcome in terms of antibiotic resistance due to the fact that their spectrum of activity or their amplitude of activity is very different. We saw how important it is to diagnose precisely the organisms and even to subtype them, because the same name doesn't mean the same biology. We've seen different clinical examples of that. Would it be deep-seated infections? Would it be simply colonization? And this zoom out from the genes to the clinics ended up to nice global picture of epidemiology showing how unevenly those concerns are distributed onto the planet. More worrisomely, also how antibiotic residue are spread onto the planet too. So when scientists see that, they try to think about that and they try to understand what this is about. So they try to tackle mechanisms, to develop models, or redeveloped new models to understand that a bit better. They try to understand key steps of dissemination or of fitness. They try to measure the costs that it drives to us as scientists, to us as people, or to us as population. And they try to measure how much investment we need to do for that. And that's maybe one of the good news that Stefan brought, one of the keywords. It could be an opportunity to invest in that. And I think we'll end up with that thing, because acting, which is what matters, is very multifaceted. We talked about antibiotics, vaccines, phages, monoclonals, host response, microbiota. And we talked also about diagnosis, about metagenomics, about techniques. So there is no single way to tackle that complexity, but we have to tackle that complexity. So how to do that? I was struck by two pictures that I saw today. One, it was those beautiful time-lapse microscopy pictures showing how rapidly the bugs divide and multiply. They are very fast. We are not to that pace. And the other thing that Patrice said this morning was, well, whatever happens in the community, if you shake hands, and we will continue doing that, you transmit bugs. So that's bad news. But the good news is still handshaking. And this is a special meeting with special handshaking, special discussion, so that we can exchange and understand a broader picture of what this is. We can have a shared vision of the problem. We can have some ideas about the actions. And what we need to do now is define opportunities, define ideally global funds or other strategies to federate that, to make sure that what we've learned, that what we would like to do can be somehow done in conjunction with all of us. But at the very least, we were able to share some understanding, share vision, and I hope that this will help us being more sensitized to that, get better connections, and try to do things a bit better and a bit faster altogether. This being said, it's 6. I promised you to stop at that time, and I would like to thank you very much for your attendance. I hope you enjoyed the meeting. Thanks.